Coming up next on Functional Moms Podcast.
Does eating a high-protein diet damage your kidneys?
No, that's the biggest myth on internet. I'm here to bust that myth because if you have normal kidney function, you're otherwise healthy, there is no reason you should be putting any restriction on the protein. That protein is gonna get metabolized and all the byproducts are gonna get released and filtered out with your kidneys. But when the kidney function declines for any reasons, especially in patients who have other comorbidities, like my diabetes patients or heart failure patients, they start having kidney issues, then we put them on protein restricted diet.
Welcome to Functional Moms Podcast, lifestyle medicine for women over 40. Let's age on our own terms. This episode is for you if you're struggling with weight gain and tummy fat after 40. We are going to learn how the kidneys play a real role in how we age. And here at Functional Moms Podcast, we are all about aging strong.
Dr. Neetu Sharma, otherwise known as the Kidney Whisperer, helps patients shed unwanted belly fat and unravel their metabolic dysfunction. She is a board-certified physician in internal medicine and nephrology, as well as functional and metabolic medicine. She is the founder of Zeal Vitality, which empowers patients to reverse disease and extend longevity.
Dr. Sharma, thanks for coming on Functional Moms Podcast. So many of our listeners struggle with weight loss resistance in their 40s, 50s, and 60s, and the health of our kidneys is probably the last thing on our minds, to be honest here. So why should our listeners care about kidney health?
Thank you so much for having me, Kristen and Raquel. I really appreciate your time. Yes, it is an important topic. Unfortunately, 42% of Americans are obese, and it's a pandemic going on right now. And unfortunately, nobody pays attention to very important system in our body, which includes the kidneys. It's the filtration system. And filtration system, it includes your kidneys, your vasculature, as well as your cellular system, where you have to make sure that your toxins are not building up in your blood. And when it does, it causes a lot of inflammation, and that leads to weight gain eventually, along with other chronic diseases.
So what you're saying is that the kidneys are our filtration system and they are removing toxins. And if that system is not working well, that could contribute to our weight gain issues?
That is correct. And many of the patients who struggle with the kidney dysfunction are actually overweight. It's a vicious cycle. Even the kidney dysfunction starts with metabolic disorders, and kidney dysfunction leads to more metabolic disorders and cardiovascular problems, along with the weight gain.
Just for some listeners that may not be very familiar with, what does metabolic health mean?
Yeah, so everything, in my field where I'm coming from starts with your metabolic health, which includes your heart, your blood pressure, and your cholesterol. And what we mean by metabolic syndrome is when we start seeing that your lipids are off, especially your triglycerides are up, and your waist is more. There are certain numbers which we look for in men and women, and it varies. So if you are having increase in your triglycerides, your lipid panel is off, or you have increased waist circumference along with high blood pressure, that constitutes together as metabolic syndrome.
And so a lot of us are seeing that weight gain around the tummy, like that belly fat that you really start to get after 40, and it's much harder to get it off than it was when you were younger. So how could our kidneys be playing a role in that?
Yeah, so belly fat is also called as visceral fat. It's actually not on top of your abdomen, but it's around the important organs in your belly. And that fat is a brown fat, which is really inflammatory and not a good sight to have morphically and as well as, in a health space, because it contributes to a lot of cardiovascular diseases. So when the kidneys, they become sluggish, it causes buildup of a lot of toxins in our body in the form of BUN, which is the urea marker, which we see, along with the GFR. So, normal GFR, which is glomerular filtration rate, is more than 90 in adults. So, when it starts decreasing, that means your kidneys are under stress. And there are multiple reasons for that. And when we have kidneys under stress, they don't filter blood very well. So, usually in a day, we have about 50 gallons of blood going through our kidneys. So, they are really working hard to make sure that whatever we do, whatever we are exposed to, and whatever we eat, all those metabolites, they have their byproducts, which are toxins to us, and that gets filtered through the kidneys. And when kidneys are sluggish, they start building up those toxins in the blood. And when these toxins they rise, they causes not only inflammation, but also it affects your cardiovascular health and your cellular health at the mitochondrial level. So everything is backed up and it causes increased inflammation in the body, increased cardiovascular dysfunction, and it also causes aging. So everything is linked together to that filtration system.
It's so interesting because you always hear about the liver. The liver is your,
Right.
filter. It's getting rid of all the toxins, but you don't hear as much about the kidneys that it plays such an important role in detoxifying you. And so I guess our question then would be, what are the warning signs of aging kidneys?
Yeah, so, it's interesting, as you mentioned, liver or gut health is very, very important. And of course, everything works together, but kidneys are as important as any other organ in the body. We just take kidneys for granted because we have two. Probably that's why. But, when you start seeing your blood work in the kidney realm with the GFR being low, it affects actually both the kidneys. It's not just one kidney. So we have to be mindful about that. And everything which goes on in your body, it affects your kidneys. We know that kidneys is a very rich in vessels, in the blood vessels, because it filters out about 50 gallons a day.
That is a lot. Yeah, that's kind of shocking. 50 gallons. That is a lot of blood you're talking about.
That is correct. Yeah. So when we see that other organs in our body are under stress, or we are in general under stress, it causes effect on the kidneys and they react to the stresses going on in our body. And that's how we find out that they are also getting sluggish, the GFR is declining. And early signs, in kidney world, we don't have really the symptoms of kidney disease unless it's too late. So there are 5 stages of kidney disease. Stage 1 is, when your GFR declines below 90.
And just to back up there, because a lot of people might not even know what GFR is. And I actually had to look because I heard you on another podcast talking about it. And I was so interested because it is something that typically would be measured on your annual physical. But, it's not something I ever really looked at. So if you could help us understand why we should care about it.
Yeah, I'm actually glad that you asked me, Kristen, because, GFR is glomerular filtration rate. What it does tell you is that how much is your kidneys are functioning in percentage in a nutshell. So, and that is also, getting tested all the time when we go to our doctor's office with your basic metabolic panel. So every basic or comprehensive metabolic panel has these markers for the kidneys, and they are very important to look at. Number 1 is the GFR, which I talked to you about, which is the percentage of kidney function. Number 2 is BUN, which is the urea. And blood urea levels also start creeping up when we have kidneys under stress. And number 3 is creatinine. So out of few markers which we have in your basic metabolic panel, 3 or 4, actually albumin is the another indicator which we have to look at. So 3 or 4 of those are actually kidney markers. And unfortunately, physicians are overworked. They don't have time to explain and each and every number on your test. So it is your job to educate our audience about these numbers and their importance, which is related to their health. So when we look at the GFR, it is the first sign of kidney stress when it starts declining. So you will see your creatinine is going up and your GFR is declining. So it's inversely related to your kidney health. So the higher GFR means it is directly related to kidney health. So higher GFR means you have good functioning kidney. So normally it should be more than 90. So when it declines below 90, from 60 to 90 is stage 2 kidney disease. And stage 3 kidney disease is between 40 to 60. And then we have stage 4, which is below 40. And stage 5 is end stage renal disease when we are looking at other modalities like dialysis to sustain the life.
So that's very helpful because I think most of the time the doctor doesn't really mention these numbers or anything. I heard you say that on another podcast also that how you can track it over time to see, are you dropping lower, or, or is it staying in the higher range? And then is it true that as you age, everybody's is going to drop to a certain degree?
So, yes and no. I have had a lot of patients who were over 60 with actually GFR better than any 30-year-old. But at the same time, I have had elderly patients more than 65 who have low GFR. It all depends on other comorbidities you have. If you have heart disease, you have diabetes, that's going to affect your GFR and your kidney function. So if you're overall healthy person, your GFR should not be abnormal. And even if it is, between the range of 60 to 90, we have to monitor it very, very closely.
What are things that you would be doing so that you have healthy kidneys?
So it's a very broad question. I can spend the whole day explaining all
Really?
the things we can do to help kidneys. But in a nutshell, the advice which goes for other organs also apply on your kidneys. So starting from the stress management to having a better sleep to
Mm.
eating the phytonutrients and nutritional diet is very, very important. So the more, it's the whole point is to combat the oxidative stress on the kidneys to decrease that inflammation to help the kidneys thrive. So
Oh,
all those advice also applies. The other things which I noticed in my practice is that people, they are using over the counter pain medications quite a bit, and especially in the category of NSAIDs, which we call, which includes the Motrin, ibuprofen category, that can affect.
So Advil, Motrin, like all
Correct.
those. Okay.
Yeah. So that can affect kidneys in a negative way, in a very harmful way. If we see that you are consuming those medications on regular basis in high dose, that can affect your kidney function. There are certain drug interactions, certain antibiotics, which can also cause acute kidney injury. But the good news is once we know that and we stop taking those harmful medications, over the counter pain medications, that we can reverse the kidney injury or kidney issues at that point. But if it is settled for more than 3 or 4 months, there is chronic inflammation in your kidneys, and chronic inflammation leads to fibrosis of the tissue, and then the chances of recovery get slim.
Okay, so it's something that we have to be mindful of. It's safe to take things like Advil, though, in motion. You just don't want to take a lot of it. Is that what you're saying?
That is correct. These medications, they work wonderfully in any musculoskeletal pain, better than, Tylenol or acetaminophen. So we have to take these medications. I'm not eliminating that fact, but just be mindful of not overusing it or overdoing it for extended period of time.
what are the worst foods for kidney health?
Yeah, so in general, when you are healthy, you can eat whatever you want. I tell my patients all the time, if the kidneys are, even more than 50% of kidney function is there, I don't put people on any restrictions. The food in general doesn't impact the kidney, but their metabolites or byproducts when the kidneys are sluggish impact your health. So when your kidney numbers they decline, they cannot eliminate some certain byproducts from your body, which includes the byproducts of the protein and certain foods like which are rich in potassium. bananas, avocados, tomatoes, potatoes. They are all rich in potassium, nuts, chocolates. So once you have sluggish kidneys, they are not able to eliminate excessive potassium from your body. And then you will start seeing that their potassium rises, and that can cause arrhythmias or heart issues later on. So we have to be mindful about that. And so initially, we don't put any patient on restrictions, but once their kidney function decline at certain point, less than 40-50%, then we start putting them on a low potassium diet or low protein diet.
Oh, okay. Because so does eating a high protein diet damage your kidneys?
No, that's the biggest myth on internet.
Okay.
So I'm here to bust that myth because if you have normal kidney function, you're otherwise healthy. There is no reason you should be putting any restriction on the protein. That protein is going to get metabolized and all the byproducts are going to get released and filtered out with your kidneys. But when the kidney function declines for any reasons, especially in patients who have other comorbidities, like my diabetes patients or heart failure patients, they start having kidney issues, then we put them on protein restricted diet so that all those byproducts like urea is one of the biggest byproduct of the protein metabolism, then it can cause confusion, it can cause brain fog, it can cause other issues like you will have itchy skin and all those things. So once it starts creeping up, that just tells you that the kidneys are sluggish. So normal healthy adult, they can eat as much protein as they want. Usually, especially if you are very active, you're going to gym, you're building your muscles, it is okay to have 1.5 grams per kilogram of protein of your body weight. Mhm.
That's really helpful to know, and I think that the message here is that you definitely wanna be tracking your kidney health though too, because if you're following some of these trends, a lot of our guests talk about the importance of protein for women over 40, but you definitely wanna be, I guess, mindful of your kidney health and tracking it as well if you're making those kinda dietary changes where you might be increasing your protein so high. It sounds like we should be keeping an eye.
Correct. So, like anything, we have to do our physical exams. And if we see, like, even I had a patient who was actually doing a lot of workouts and he was running like 2 hours a day. And he started taking those protein supplements and in a very high quantity. He was a very muscular man. So, in that regard, I would expect him to have a little bit of higher creatinine and a little bit of higher BUN than the normal person because his muscle mass is so high. So creatinine just tells you your muscle mass. And his GFR was normal. It was more than 90. And he asked me, do I need any restrictions? I said, no, you can have that big amount of protein because you're working out. But so after 3 months, when he came back, he said that I recently had a marathon. So I ran some tests and his GFR actually was lower at that time. And that happened when I traced it back was because of dehydration. So he was doing marathons, he was doing training, he was not hydrating himself very well. And that made the kidneys a little bit sluggish and declined his GFR. So GFR is a very good marker which can tell you what's going on from time to time. And I would recommend checking it every 3 to 4 months.
So hydration is I've heard you like in another podcast talking about the importance of hydration connected with the kidneys, which I think I've heard that too. And I've even heard people talk about like cranberry juice, like drink cranberry juice to help flush out your kidneys. Is that true?
So it's a two-part question. So first is hydration. Yes, hydration has very important role to play for kidney health. If you're well hydrated, you're drinking good amount of water, then it's going to help your kidneys to flush that 50 gallons of blood and filter it on regular basis, and there is nothing backing up. Dehydration can cause problems because what happens is at the cellular level the kidneys are not only just filtering your blood, but they are also sensing your blood pressure. So with the dehydration you are at risk of dropping your blood pressure too. And when the kidneys sense, oh, you are dehydrated, I have to actually preserve on whatever fluid you have left on your body so that you don't drop your blood pressure. They causes those vessels to constrict. I'm not thinking the other word for constriction, but it just narrows down your
Right.
blood vessels. So when blood vessels are narrowed in the kidney, you can imagine, which is a very vascular organ, what happens to that kidney? It will be decreased blood flow because kidneys need a lot of oxygen from your blood to work at the good pace. And when that oxygen declines, narrowing of the blood pressure, that vessel causes the kidneys under stress, and that decreases the kidney function in the term of GFR. So it is very important to keep yourself hydrated. I'm sorry if I'm going more into physiology of it, but I hope I'm making you understand it. And please feel free to ask questions if you have. So the second fold is cranberry juice, you asked. So cranberry juice is actually the reason. There are some old studies which are not like a big studies, but it's more like a case studies, which
Uh-huh.
have shown that cranberry juice, it helps with preventing the urinary tract infections. So it clears up your bladder, and the bacterias, they don't adhere to your bladder wall, doesn't cause the infection. So that's why we promote cranberry juice in general without sugar. You don't want to drink too much sugar.
That's the tricky part. Yeah, because
Yes.
usually the one that tastes really good has a lot of sugar in it.
Yeah. So I would actually advise not to take cranberry juice with sugar. So there are certain other brands which have no sugar in it
Mhm.
to just get the benefit of it, but without having the detrimental effect on your metabolic health. So it can prevent urinary tract infections, but in general. So
Okay.
people who are getting a lot of UTIs, I recommend them to get cranberry juice.
So when you talk about hydration, I'm also curious about like electrolytes, for example. So if people put electrolytes in their water because they're trying to like really double down on their hydration.
And I'll add that I started doing that, and I felt like I was getting more energy from it. If I did it in the morning, especially because I probably woke up dehydrated and drank coffee. So, yeah, what are your thoughts on that?
So electrolytes, I would recommend if you're, outdoors, you're sweating a lot, you are actually losing a lot of sodium or salt with your sweat. So that's why the
Okay.
sweat is salty because your body is just losing that sodium. And the sodium has a lot of effect on your blood pressure. So when you start consuming a lot of sodium, like in SAD diet, which is standard American diet, we have a lot of sodium in our diet, which is around 6 grams. I would say the recommendation is less than 2 grams to have in our diet. So we are consuming on regular basis anywhere from 4 to 6 grams of sodium a day, which is a huge amount, and the kidneys have to deal with it. So the main role beside filtration, blood pressure management for the kidneys is to get rid of excessive salt from your body. So your urine will have that sodium. If you're consuming too much, that causes retention of water in your body. And you can start seeing a lot of ankle swelling, swelling around your eyes, some puffiness. When you wake up, your hands are swollen. Those are the signs that you're consuming too much salt. And that can also cause high blood pressure over the period of time if you're not taking care of yourself. And so the kidneys, they have a role of excreting that excessive amount of salt by regulating your blood pressure, by regulating the filtration, but they can only do so much. So I would not recommend adding excessive electrolytes if you're not running a marathon or you're not outdoors and sweating a lot. But if you are, moderation of electrolytes are okay to take in general. If your diet is full of salt already, then you don't need excessive electrolytes.
Interesting, because it's become such a trend now,
Yeah.
and I think, one of the really popular ones is Element, like, I've taken those, and that has, like, 1,000 milligrams of sodium, so that's a lot, right?
So
Because
that's like half of your daily requirement.
for my whole day, right? So, how would I know if I'm getting too much? I heard you say something like I would look puffy, I would feel puffiness, like, things like that.
Yeah. So you will see that you will have excessive, like your ring is getting tighter in the morning, So those are like mild signs early on. You will start feeling that change in your body, some puffiness around your face, around your ankle. So what sodium does is it just attracts all the fluid and retain it in your body rather than getting it filtered out through your kidneys. And that's why you start seeing that puffiness, some weight gain, and even rise in your blood pressure. It might be small amount if you're regularly checking it, but significant enough to be noticed.
So, definitely something to be cautious if you have high blood pressure or borderline like that. Like, I have to say mine's usually very low blood pressure, like, I'm kind of the opposite, but That's good to know because I feel like it's everywhere. Like everybody's saying, you need electrolytes, not just water. So,
Yeah, there is a reason they are saying that too, Kristen. There is a science behind it. So if you are outdoors and you're sweating a lot, or you are athlete and you are a marathon runner, or you're on outdoor sports, you're sweating a lot, you're losing that salt. So what happens is your sodium of your body declines to very low level in a very short amount of time. And when that happens, it can actually trigger seizures in people. And I have had those patients with low sodium coming in the hospital with seizures, and especially after the marathon run when they are just drinking water without electrolytes. Because the more water you consume during that time will dilute your sodium even low. So that's why they are coming up with the low sodium. So there is like, balance like anything in our life, right? So we have to be mindful about that.
Yeah. It's interesting because I have a client that was away on vacation with her daughter, and then she had texted me to tell me that she was in the hospital on vacation because she got a kidney infection and it went into her bloodstream. And she says she felt really awful and she was in the hospital. She's been in the hospital for days there.
Yeah, so a pyelonephritis is very, very common. That means the kidney infection or urinary, it comes from urinary tract infection. So I suspect there must be something going on. Was it a young daughter?
No, it was my client. So she's like, I'm going to say, I believe she's 69.
Okay. Yeah, in elderly also because of bladder dysfunction, they retain the urine for longer time, and that is also a nidus for bacterial growth, which can cause back pressure into the kidney, and from the kidneys it travels into your blood. So that happens a lot. I have had a lot of patients who were suffering from kidney stones, and kidney stone is another risk factor to have that infection in the kidney tract, which causes sepsis. So I think what she needs is a proper evaluation to make sure there's no other risk factors involved.
Mhm.
Diabetic patients in general, they have a lot of sugar in their urine, which attracts bacteria. They are at high
Mm.
risk of getting urinary tract infections as well. So those are the few of, risk factors which I just mentioned.
Yeah, yeah. It's so interesting because you also hear like women 40 and over, bit life women, and the lack of estrogen and the increase of urinary tract infections is also, it seems like that's also another thing that we have to look out for.
So the thing is, with middle-aged women, there are hormonal changes happening in our body, and that causes insulin resistance eventually. And that all linked back to what we discussed already with the metabolic disease and metabolic syndrome, and which affects the kidneys. And I think it's all related together.
Yeah, it's really interesting.
it always goes back to the metabolic resistance and all that. Like, and the,
That is
it's just,
And
correct.
yeah, and does our urine color tell us what does our urine color tell us about kidney health? Does it tell us anything? Because you usually hear that, right? Like if you have your pees really dark, that means you need to drink more water. Is that true? Is that
Definitely.
connected with our kidney health?
Definitely, yeah. So
Okay.
those are also the first of the signs we have to look for. If it is a very dark, foul smelling urine, that means your kidneys are doing a lot of work to consume that, retain that fluid in your body. So that's, you have all the concentrated urine coming out. That means you're dehydrated. So you have to just drink more water to make it to the point when the urine is tinged yellow is the ideal color we are looking for in a healthy person with healthy kidneys. Even the white urine is not normal. That just means that you're consuming a lot of fluids, a lot of water, which is just getting flushed out. So you have to slow down on that regard.
Mm.
Having a foamy urine is another sign, which is very, very common in early on. So foam in the urine just tells you that you have protein in the urine, and there should not be any protein in the urine for a normal person. So when kidneys start leaking that protein, that actually is the first sign of kidney dysfunction. So we have to look into that.
So when you get like when Kristen was talking before about getting your yearly blood work done, those are things that they look for, right? They're looking at, do you have any protein in do they look at that in
Yeah.
when you get all your stats done?
Yeah. So yearly physical should involve the urinalysis. That is the analysis of your urine. And so most of the doctors, which I'm really frustrated about during my practice, is that in the primary care physicians, they check urine with a dipstick test in their clinic. So that test is not having a good, it's not very specific. So it might have it might show that you have like high glucose or protein in the urine. So we have to actually measure the protein in the urine from random urine tests, which we can send out to the lab. It comes as urine protein to creatinine ratio. That's what we look at. And usually the first protein which starts leaking is the albumin. So in diabetic patients, it's very common. When you start leaking that protein, what it causes a lot of fibrosis in your kidneys, inflammation, and that causes kidney problems and kidney disease later on. Yeah, this should be tested every 3 to 4 months along with your metabolic panel.
Okay, so you're saying every 3 to 4 months if you have that condition.
Correct. So if it is
Okay,
positive,
right.
then you have to test it every three
Yeah.
to 4 months. Otherwise, physical exam once a year.
That was my question because that was my next leading question was that do you think it's enough to do it just once a year or should we be doing it like every 6 months or is once a year good if you're basically healthy person?
Yeah. So if you're healthy and there's no protein in your urine, once a year is fine.
Okay.
Mhm.
So that's good to know. So, being mindful of our time, Dr. Sharma, what are 2 things we can do today to improve our kidney health so we are aging strong?
Yeah. So number one is, getting the good phytonutrients in you in general and some activity going out in sun and combating your stress is important. So the general lifestyle advice is what I would give you to follow to keep your kidneys healthy, to keep the aging a little bit slow, and especially in mid-age women during the perimenopausal menopausal stage, and it also helps with your metabolic health. And number two is hydration. So make sure you are drinking a lot of water and keeping yourself hydrated.
What is a lot of water?
In general, for a normal person, it's about 8 to 10 glasses of water a day. If you are doing a lot of outdoor exercises or outdoor work with a lot of sweating, then increase that amount by 3 to 4 glasses.
And when you say, do you mean like an 8-ounce glass? Is that what you consider a glass of water?
Yes.
Okay.
Yes. Mhm.
Okay. And then you talked about nutrition, right? One of the 2 things you talked about nutrition and exercise and those things because that affects our organs. And you said phytonutrients, right? So, but
Correct.
can you just break down what phytonutrients are just to be clear for our audience?
Yeah, so phytonutrients are the nutrients which is derived from plant. I'm not talking about meat here. I'm talking about different colorful, yummy vegetables you eat and make sure that each meal has a lot of different colors to it. I follow the rule of rainbow with, making sure there's green, there's some yellow, some purple vegetables. So all these nutrients or phytonutrients, which are derived from the plant, are rich antioxidants, and that helps your kidneys to thrive.
Okay.
Great.
Thank you.
I'd like everyone to know they can connect with Dr. Sharma on Instagram. Her handle is The Kidney Whisperer, and also follow Zeal Vitality on Facebook and YouTube. And can you just share a little bit about Zeal Vitality for our listeners?
Yeah, Zeal Vitality is the virtual precision medicine, which is designed to help you thrive with your vitality, your longevity, and kidney and metabolic health.
Perfect. And so that's an online community that you can join and get. And would it be a great way to lose weight too?
That is correct.
That's
Yes.
what I thought. Okay. So it will help us if it'll help our kidneys, but it'll also help shred that unwanted belly fat that we're all struggling with.
Yes.
That is correct.
Perfect. Love it. Well, thank you so much for coming on today, Dr. Sharma.
Thank you. It's my pleasure.
We need your support. If you're enjoying the show, follow, like, and subscribe. Thank you for Aging Strong with Functional Moms Podcast. We would love to hear from you. Please leave a comment or review. Email us at info@functionalmoms.com. If you enjoyed this episode, please hit the subscribe button.